today's theme, as we look at saving mothers and newborns at national and local level, I want to say that as much as the midwives, obstetricians and nurses have a very important role to play, we can't keep putting anesthesia behind. For long, surgery has been the neglected stepchild of global health and has been ignored. A lot of funding has gone into HIV, malaria and TB. And as these have been addressed, we're seeing increased number of non-communicable diseases, among which we see maternal health increasing, maternal deaths increasing. But many of these are preventable, and unfortunately, by the time we realize we need the anesthesiologist, it's a critical situation. So the anesthesiologist is basically the custodian of the critically ill mother and the critically ill baby. So I think even as we start out to do the Helping Babies Breathe projects and all these other projects that we're doing, instead of us remembering at the last moment when the mother's life is at stake that we need them, it's high time we actually put them at the center of this, saving mothers and saving newborns at national and local level. They'll be important in emergency care, looking at neonatal resuscitation and maternal resuscitation. As you can see in this picture, everybody is comfortable, but that's simply because the anesthesia went right. There is no such thing as safe surgery without safe anesthesia. In this study, I used the World Federation guidelines for safe anesthesia, and as we'll go through if time allows, these are very basic standards that were set by the World Federation. And for each level of healthcare, basically two main things: the presence of a trained anesthesia provider and monitoring, because monitoring actually gives this person early warning of a patient's condition. And these guidelines for the various levels of healthcare, we have highly recommended for level 1, highly recommended for level 2, and then for level 3, as we'll see in detail later. A level 1 hospital is basically a rural hospital that has normal deliveries and a few other procedures. For a level 2, we are looking at a district hospital where we have cesarean sections, laparotomies, and more procedures, as we can see listed there. Level 3 represents a referral hospital. This is where we have a regional referral and district hospitals with more advanced surgery going on. And these standards basically looking at for a safe obstetric surgery, for safe obstetric anesthesia, for the ability to provide safe regional and safe general anesthesia. And one of the most important things is pre-anesthetic care, and then pre-anesthetic checks. Here we have the WHO surgical checklist, and then pre-checks that we usually do before we start surgery. Monitoring is also very important, and we'll go through this very fast. We usually look at the ABCs, and oxygenation is very important. And the guidelines specify monitoring of expired oxygen and oxygen failure alarm for the equipment, and then protection against delivery of hypoxic gas. And this is just an example of oxygenation